Good morning, and welcome to day 3 of the Psoriatic Arthritis breakfast briefings on Sunday, November 8th. I'm your breakfast briefing host, Alan Gabalski, professor of medicine at Weill Cornell Medicine and a rheumatologist at Hospital for Special Surgery in New York. This morning, we're highlighting abstract 0619 from Sharma and colleagues from Beth Israel Deaconess Medical Center in Boston, titled Pharmacist Intervention, Reducing Insurance Denials of Specialty Medication. Very often in rheumatology, we are required to get prior authorization from the insurance carrier before we can use a medication that we deem necessary for patient care. Not infrequently, our request for use of an agent is not approved, either because the insurance formulary thinks that another agent should be used first, or the insurance formulary thinks that another agent of a similar class should be used instead, or because the insurance formulary thinks that the care of that patient is becoming more expensive and the costs are greater than they'd like to incur. Now, there are also inconsistent formularies that don't necessarily align to the ACR treatment guidelines, and there are also formularies that sadly may have restrictions on access to the specialty medications we need. Now, this was a retrospective analysis of pharmacist interventions related to insurance denials, and they looked at some of the common reasons for insurance denials in an attempt to determine if there are interventions from pharmacists that can impact denials. Pharmacist interventions included writing the appeals letters, providing supported literatures, and so on. The reasons for medication denials were off-label use, step therapy requirements, and quantity limits. These are the most frequently encountered denials in rheumatology practice for reasons that I outlined earlier. Either the plan does not want to approve the drug because it's not indicated for the condition that we seek to use it in. The plan does not want to approve the drug because they'd like to see if another drug, cheaper to obtain, can provide efficacy first, or they don't want to approve the drug because the dosage that we're prescribing, which we think is consistent with the clinical burden, is greater than the cost of therapy that they'd like to incur. Now, this study demonstrates that by enlisting the aid of our colleagues in pharmacy, it may well be possible to reduce the pre-authorization denials that we all face and have a better chance in obtaining the necessary medications that we think are clinically important for the care of our patients. Why is this important? Well, our rheumatologic conditions are progressive and debilitating. And for that reason, access to medically appropriate medication is necessary. It's important to collaborate with the pharmacist, especially the specialty pharmacist, to enhance the possibility of reducing the denial of prior authorizations and getting the medication for the patient. And we should really be looking at our pharmacists as a valuable asset on the healthcare team that will help us in reducing denials, reducing the existing burden on providers to provide the paperwork for prior authorization, and to improve the timeliness of patient access and care.